Right. Good afternoon, everybody. I hope that you had a chance to check out the para-sport activity. Nice weather. Great. So huge thank you to the Active Living Alliance for doing that for us. I hope that you've had a chance to take that in over the course of the summit. So right now we're here to present to you our call to action. So as we've said at the beginning of the summit, one of the key aims of the summit was to motivate coordinated action and continuous improvement of initiatives to increase physical activity for children and youth. And with that, we issued a challenge to delegates this morning. The challenge was, how will you use the knowledge presented at the Global Summit to influence policies, programs, campaigns, investments, and research that enhance physical activity opportunities for children and youth in your own countries and communities? And each day, we did a prize draw to reward you for participating. And so I just wanted to announce our winners from Wednesday. And so after today's, this session, you can go to the registration desk and get your prize. So Wednesday, we have Allison Jeffrey. And Thursday, Richard LaRouche. All right. So you can pick up your Active Healthy Kids Canada portfolio at the registration desk. So this was our challenge, and over the summit, we've captured your responses throughout using Twitter and using our call to action cards, and we're going to start off the afternoon with a high-level summary of your answers to this question. So first of all, we've created some word clouds at different points during the summit to capture some of the trending discussions and generally understand what delegates and essentially everyone that you guys are connected to were thinking. And so here's a word cloud just from the first day of the summit, and so most of you know how word clouds work, where the larger the word, the more frequent the words were used. So this is just giving us a little bit of a flavor of the tone and enthusiasm of your tweets and your cards. It's evolved to Wednesday afternoon or Wednesday morning, Wednesday afternoon, and just now. So at the end of the first day of the summit, we were the top trending topic in Canada on Twitter, and thanks to all of you for getting the world talking. And collectively, we've reached over 1.5 million individuals. So this is just the people in this room that you are directly connected to. Your tweets have traveled around the world, and 1.5 million Twitter followers are part of this conversation, and that's thanks to you. And that's just during doing Twitter. Imagine what you can do when you get back to your own communities, and imagine the significant influence that you have in so many realms. So we've touched a lot of people, and how are you going to continue to do this when you get home? And so the calls to action, we had them on Twitter, we had them on the cards. We looked at all of them, and they actually had two general categories. Many of the responses had to do with what you thought other people should be doing. So that was a large flavor of some of the responses. And then the other half of the equation was about what you could do as a key influencer of physical activity. So here's some examples of what came up with those two categories. So from what we need, these are things that you've said that we need. We need things like funding. We need strategies for the early years. Many people commented about how that could be a gap. Physical literacy came up as a key component. A lot of discussion about schools and what we need in terms of health and phys ed and what we need in terms of qualifications for teachers. We talked a lot about parents, and an overarching theme in all of this was about accountability. And I think that that speaks to the concept that we've been talking about with the Canadian report card. We've got all sorts of policies, programs, initiatives, but where's the accountability for implementation? So that was definitely echoed in your comments. From a what can we do perspective, we're just providing you with a few key examples of what our colleagues have said over Twitter. And so here's one really talking about the need to change the culture. Thinking a little bit about the partnerships that you'll be creating with parents in your community and families when you get home. Thinking about your role as educators and whether that's educators proper or the fact that we're all on the front line some way with children and youth and how you can work to make a difference. Thinking very specifically about the opportunity that you might have within an existing structure in Canada. Even though we've said we've got a lot of structures, we can still do better. And so here's an example of someone who could think of an opportunity to be where they are and do better. Thinking a lot about what some of the panelists said in the first morning, building capacity in this area, including research, and we heard that throughout the summit as well. one of these novel examples of the sense that we seem so well connected. Why don't we send out a tweet at 7 o'clock in the afternoon or 7 o'clock in the evening and tell everybody to get off and get to bed? And then even remembering that even though we are key influencers, we got to walk the talk. So just reminding ourselves that if we have to be the change that we want to see in the world. This is my favorite one that came in. So you may have noticed that there was a little girl who was here this morning, kind of in and out of the keynote. And so as part of the summit, she actually put in a call to action, and she said that she went for a 5K walk with her mom. So that's awesome. And that's what we have to remember, and this is a tweet echoing what Shelley Foll said to us in the keynote. Will today be the day that we recommit ourselves to the purpose, the passion against all odds? So that's really what you guys had to say about your experience with the knowledge here at the summit. So indeed, the global matrix results revealed at the beginning of this conference are troubling. We've heard it being described as a crisis, an epidemic, an emergency, almost like a fire. But what can we do?
We are constantly being bombarded by problems that we face, and sometimes we can get completely overwhelmed. The story of the hummingbird is about this huge forest being consumed by a fire. All the animals in the forest come out, and they are transfixed as they watch the forest burning, and they feel very overwhelmed, very powerless, except this little hummingbird. It says, I'm going to do something about the fire. So it flies to the nearest stream, takes a drop of water, and puts it on the fire, and goes up and down, up and down, up and down, as fast as it can. In the meantime, all the other animals, much bigger animals like the elephant with a big trunk, could bring much more water. They are standing there helpless, and they are saying to the hummingbird, what do you think you can do? You're too little. This fire is too big. Your wings are too little. And you're big, so small, you can only bring a small drop of water at a time. But as they continue to discourage it, it turns to them without wasting any time and tells them, I am doing the best I can. And that, to me, is what all of us should do.
So that was just a great way of describing and motivating you to say that we all can do the best that we can. And we know that you're doing the best that you can, and I hope you feel like you're not alone in fighting that good fight in your communities. So partnerships were absolutely essential to prepare and present this global summit. And our objective was to recruit a group of partners with different spheres of influence and a sincere commitment to advancing physical activity for children and youth. And in particular, those who have solutions or support available to facilitate the responses to the knowledge gleaned and the issues raised at this summit. In other words, these are some hummingbirds. So we're pleased to have them join us today to provide some further details about how they're going to respond, and in many cases, how they're going to help you in responding to the issues raised over the past 3 days to improve the grade when it comes to physical activity for children and youth. And so what we're going to do is we have a number of partners. They're going to come from both sides. They're going to all give you some examples, and we'll look forward to hearing what they have to tell us to improve the grade.
Good afternoon. Participaction is the national voice of physical activity and sport participation in Canada, and our national not-for-profit organization is dedicated to inspiring and supporting Canadians to move more, largely through social marketing campaigns. We commit to taking a drop of water and taking what we've learned here at the summit, whether it's to continue to promote physical activity or possibly think about promoting the reduction of sedentary behavior, or encouraging families to park the car for distances of less than 1 kilometer, or to address the disconnect between the true extent of risk and the parents' perception of risk in allowing kids to be physically active. There are so many insights that we will take away from the summit and from this year's report card to inform Participaction's communication to the public and the sector about the issue of child and youth inactivity going forward. We see this opportunity to bring research to Canadian parents and families through our campaigns and initiatives because we've done it before. When Active Healthy Kids Canada highlighted the decline of active play over the past generation in 2012, this put on the radar with Canadian families, and people started talking about the way we used to play. Participaction used that knowledge and the resulting public interest to inform the brief for a national campaign called Bring Back Play. We developed an app to help teach kids the games that their parents used to play. We created Unplug and Play Week. We created Longest Day of Play. We created posters, messaging, web banners, radio and television ads, and did interviews and talked about play with the media. And as a result, we saw supportive messages around play getting picked up by other organizations as well. Active Healthy Kids Canada does power the movement to get kids moving. Ultimately, the Global Summit and the report card will inform and power Participaction's mission to inspire and support Canadians to move more. Jen, thank you to Active Healthy Kids Canada for your leadership.
Hello, Global Summit. I'm Andrea Cohen-Barrick, and I have the great privilege to be the CEO of the Ontario Trillium Foundation. Really want to thank you for having me here today. We were thrilled to partner with Healthy Active Kids Canada to invest in this conference because we believe strongly in the link between healthy and active kids and building healthy and vibrant communities, which is our mission at OTF. This summit comes at a great time for us at the Foundation. We're rethinking how can we better meet the needs of communities, and this work is going to culminate in what we're calling Redesign 2015. It's an overhaul of the way we invest our granting budget, which is about $110 million a year annually. We want to focus on key objectives that we believe will make a difference. So just last month, the Canadian Index of Wellbeing released an Ontario-focused report that we commissioned. For those of you who don't know, the Canadian Index of Wellbeing is a composite. It's an index that looks at a number of factors that influence well-being, and it's supposed to be an alternate to GDP, to determining how well are we doing as a country. We were interested to know, though, how Ontario was doing and how we might increase well-being in the province through our investments. So to do this, we've chosen a handful of key indicators, which we're going to look at from the perspective of 6 key action areas. So as an example, one of those indicators that we're going to focus on is participation in physical activity. And that's going to be under the action area of active people. Today's goal of increasing physical activity for young people actually aligns with 3 of the new action areas. In addition to focusing on encouraging people to be more active, we're also going to encourage connections between people in their communities and also help children and youth to reach their full potential. This new granting framework dovetails perfectly with the Summit's goal of improving initiatives that will increase physical activity for youth. With our Redesign 2015, OTF will have an increased emphasis on investing more to drive physical activity levels. And by using the Canadian Index of Wellbeing, we'll be able to track our progress. This summit also hits close to one of our other goals, collective impact. Even though Ontario Trillium Foundation is Canada's largest granting foundation, we're really just a teaspoon in the ocean, and we've heard you can't boil the ocean. To effect change, to make an impact, we need to work with other funders and with other organizations, many of who are in the room today. We've had a few wonderfully successful partnerships so far, and we want to continue to engage with other funders who share our values and goals. So we're looking for new opportunities, new partnerships, to collaborate on these shared goals and shared outcomes. This call to action is really about that collective impact, pulling all in one direction. The people and the organizations that are here today are ready to tackle a shared and critical goal, increasing activity levels for our kids. By working together in pursuit of this common goal, by sharing our measurement and our data, we're going to be able to see the collective impact of our efforts. We're looking very forward to being part of this important effort as we move forward with our goals of healthy, active, and connected people. Thanks so much.
From the post-secondary education system, York University's Faculty of Health puts out a call to action to other post-secondary institutions to try to do things to improve the student experience, to improve student learning in and around children, physical activity, and children's sedentary behaviors. In order to meet one of the key objectives of the 2014 Global Summit, that is to motivate coordinated action and continuous improvement of initiatives to increase physical activity for children and youth, York University's Faculty of Health Global Health Program will be instituting an international internship program focused on active, healthy lifestyles for senior undergraduate students in 2015-16. The internships will be focused on expanding and sharing the networks developed at the Global Summit this week, and to this end, York University's Faculty of Health will be contacting each participating institution in various countries to see developing a collaborative agreement aimed at student exchange on the topic of understanding and improving physical activity opportunities for children across cultures and around the globe. Thank you.
Good afternoon. I'm Sue Scott, CEO of Cardell Place for Healthier Generations. We've had 3 wonderful days of great conversation, knowledge exchange, and shared learning. Now is the time for purposeful, focused action and that will have lasting impact on kids' physical activity levels and generational health. One of the steps that each of us can do, and this is my personal call to action, is to create environments that support kids in being physically active. Creating supportive environments means taking bold action on at least 5 fronts. 1, public policy. 2, active living curriculums. 3, civil society. 4, residential communities. And 5, public facilities. Here's one quick example of each. 1, creating supportive environments means developing new public policy frameworks and regulations. We only need laws, regulations, and rules that make sense. We don't need unnecessary legal, safety, or insurance bubble wrap that smothers kids and keeps them in lockdown mode. 2, creating supportive environments means developing new active living curriculums and programs that help kids develop the competencies and the confidence that they need for life. And we only need school-based and recreation-based programs that free kids to be kids. We don't need unnecessary prescriptive or overly disciplined programs. 3, creating supportive environments means fashioning a new civil society where communities care and where parents feel safe letting their kids out of sight. We don't need a fear-based society where the prospect of stranger danger traps kids in their homes. 4, creating supportive environments means building different kinds of residential communities where front porches, pathways, and parks bring neighbors together to connect with one another. We don't need suburbs where 2-car garages dominate the street, making it easy for parents to retreat to their cocoons without engaging humanity. And 5, creating supportive environments means designing a new type of public facility where socializing, connecting, and growing can take place very spontaneously. We don't need public buildings that are locked behind security or buildings that are for the fortunate few. Here are 2 examples of how we are taking action now. 1, we're actually designing just such a new facility. It's a facility that responds to our aging and our young, growing, and ethnically rich multi-generational community. It will feature an indoor park where, just like an outdoor park, people can come together to play, socialize, or just be. It will be a place for respite from the world, a place to connect with others, and a place to be active in all types of weather. 2, we're taking new knowledge and putting it into action now. Our innovation arm, the Canadian Academy for Healthier Generations, is using evidence-based action research to create a new, purposeful, active living curriculum. Our enterprise arm, Cardell Place, is shifting our whole approach to serving the community and those who visit our facility, emphasizing spontaneous play for both kids and adults, and helping the community shift their attitudes, values, and behaviors by going beyond our walls and into the homes, neighborhood parks, and workplaces. Creating supportive environments in these 5 areas, public policy, active living curriculums, civil society, residential communities, and public facilities, is something that each of us can do. Creating supportive environments doesn't require a lot of money or new money. It requires new thinking, new solutions, and new ways of working. Before you leave Toronto, ask yourself what you and your organization can do this year to create supportive environments for kids and for your community. Write it down, take it home, act on it, and let kids play. Thank you.
Hi, my name is Chris Markham, and I'm the Executive Director of OFIA. So PARC has been a contributor to the Global Summit, and we want to thank Active Healthy Kids Canada for the opportunity to provide comments on how we can all connect the dots around our shared challenge and shared responsibility of increasing physical activity in children and youth. We are a provincial-based organization who works with schools and communities to enable children and youth to value and enjoy the lifelong benefits of healthy, active living. Over the last 3 days, we've heard a lot about the important role that schools, parents, kids, NGOs, public health, recreation, government, and communities can play in reversing the disturbing trends outlined in the report card, and we couldn't agree more. There is a lot going on in Ontario, and I'll preface that. There are many policies, priorities, programs in place already. For instance, within the last month, the Ministry of Education released a report called Achieving Excellence that highlights the importance of student well-being to achieve education goals. Our Ministry of Health and Long-Term Care recently launched a provincial EPOD approach, the Healthy Kids Community Challenge. We have many organizations, many individuals, many groups that are committed to champion change in the province of Ontario. So I'm going to focus my comments on 3 areas very, very quickly. The first has to do with the core of the educational system as it relates to healthy, active living within the province of Ontario, and specifically as it relates to the health and physical education curriculum in this province. It is our position that students have a right to learn from a research-based curriculum that provides them with the knowledge and the skills that they need to develop their health and physical literacy. This is a right. Many of you may be shocked to learn that Ontario's curriculum is in fact the oldest in all of Canada, dating back to the 1990s. After revisions became politicized 4 years ago, our government stepped away from its obligation to ensure that kids have a current research-based curriculum. Where OFIA fits into this is we continue to advocate, along with and mobilizing over 50 sector partners to advocate for a curriculum update. It's really the basis of good education. And when you're looking at a strategy to mobilize and to get 2.1 million kids in this province up and active, this is a great place to start. We know that curriculum is a foundational component, but we also recognize that the strategies need to go beyond the classroom. And that leads to my second point very quickly. So over the past decade, OFIA and PARC have played a significant role in terms of mobilizing community partnerships across the province of Ontario. Call them EPOD-like, call them comprehensive school health, call them healthy schools. We have taken a leadership role to support and to supplement what's going on during the school day. The results of this work have been well documented over the last couple of days. Increased physical activity, trends towards healthy eating, mental health, greater community connections. The evidence is there. We need to get moving on this. We need to make a commitment to moving forward in this way. It's a bit disturbing to look at some of the great work that's happening nationally and across the world, and to note that Ontario is starting to fall behind in this regard. The last note I'll make is with respect to physical activity as a risk factor area. So there, again, there's been a lot of conversation around how do we raise the profile and importance of physical activity. I would suggest to you that one of the key roles that OFIA plays is we also host this alliance called the Ontario Chronic Disease Prevention Alliance, and we bring a physical activity lens to that. The work of Active Healthy Kids Canada and of the report card specifically has been a key tool for us to be able to ensure that there is evidence, that there's priority, and that there is attention paid to the areas of physical activity. So again, I would echo earlier comments and say thank you to Active Healthy Kids Canada for that work. We continue to use it as a key tool, so thank you.
Good afternoon. My name is Judy Norder, Mayor, and I am the Director of Communications for Sick Kids Foundation. Sick Kids Foundation is the fundraising arm for the Hospital for Sick Children. Sick Kids, as we call it for short, is the largest children's hospital in Canada. It's also the largest children's health research facility in the country. In recent years, in the last decade, we've noticed an increase in the number of weight-related disorders at Sick Kids. And it's because of that, in part, that just last month we launched something called the Center for Healthy Active Kids at Sick Kids. It's a virtual center, and it brings together researchers, educators, and caregivers to deal with weight-related disorders. It's primarily about obesity, but this team of people who are coming together are also going to be looking at nutrition and physical activity as it relates to dealing with weight disorders. And they're also going to be looking at weight and obesity as it's tied with various chronic illnesses, such as arthritis, of course diabetes, and cancer, etc. So we're so pleased to be working with you and to be working with Healthy Active Kids Canada in this initiative. Where Sick Kids Foundation comes in is that we've committed to raising close to $1 million for this virtual center, and to match it with an additional $500,000 to fund a Catalyst Scholar for the center, to fund training fellowships, to fund some innovation and seed research grants, and also to provide funding for education symposium, because we really want to build up the capacity not only within the care realm, but within different academic realms and within the public community. So we'll be working on all of those sides of it in the months and the years to come. The other thing that we're really thrilled to have embarked on this month, and the timing is just so beautiful because we're all working together on this in the month of May, is we've launched a campaign this month called Healthy and Happy, healthyandhappy.com, where it's a public education campaign primarily, where we're out there and we're trying to give families and people tips in a fun way to be healthy and active in their own lives. So if you've been here for a few days, you've probably seen this in the Toronto Star. You might have seen it on the TTC as well, but we're also doing it through a website and a variety of different other ways. We're going to do this again next May, so we're really looking forward to working with you, to seeing the progress and the development that's made over the next week to help shape what that campaign is going to be again next year. So thank you, kudos to all of you, and we're just pleased to be part of it because it's so important for creating a healthier future for our kids.
Good afternoon. I'm Colleen Hill with the Heart and Stroke Foundation, and the Heart and Stroke Foundation is one of the largest health charities in Canada, and our vision is healthy lives free of heart disease and stroke. Together, we will make it happen. And before I go any further, I'd really like to extend a heartfelt thanks to Active Healthy Kids Canada and Jennifer and her team. I know what a tremendous undertaking and risk this was to think that they could do this, and they've done it, and it's been incredibly successful and also really inspiring. So thank you very much. With our vision statement, together we will make it happen, I think the key word is together. The foundation knows that partnerships are vital to change. We really see ourselves as a connector and a communicator. And we like to think we're pretty good at relationships. We've had a long-term relationship with Active Healthy Kids Canada and have been a partner since the first report card 10 years ago. So just a quick show of hands, and I know some of the international folks have left, but how many people in the audience are from Canada? Oh, lots, okay. And how many of you are aware that the foundation does much more than fund research? Okay, so there were fewer hands. We do a lot of work in health promotion and advocacy, and long ago made a commitment to Canada's kids. And I'm quickly going to share with you just a few highlights of what we do to help kids move more and sit less. Jump Rope for Heart is in over 4,000 schools across the country. Not only does Jump raise funds to support our mission, it also provides us with an opportunity to increase children's knowledge and awareness of the importance of physical activity and healthy eating. And we are doing this by ramping up our in-class presentations across Canada, and we are looking forward to working with the 60 Minutes Kids Club in the near future. We also have successfully piloted a school intervention based on the healthy school model to much success, and this was in partnership with the Champlain Cardiovascular Disease Prevention Network and Propel Center for Population Health. They actually had a poster here. The pilot was very successful, and we are now rolling it out in the Frontier School District Board in Manitoba. We've worked together with Green Communities Canada for many years, and we're just finishing our first year of a 5-year national Active Safe Routes to School partnership. And I know that Jackie Kennedy and Jennifer Lay also did a workshop yesterday. And we were also the lead collaborator on Healthy Canada by Design, which was a CLASP initiative. And CLASP is Coalitions Linking Action and Science for Prevention. And this initiative is a partnership of public health, planning and transportation professionals, and non-governmental organizations from across Canada that are working together to create healthy and sustainable communities that support and foster physical activity, active transportation, and public transit. And we were also the sponsors, and thank you to Active Healthy Kids Canada for yesterday afternoon's session on active transportation. And it was wonderful to see, many of our researchers and partners that were here with posters or workshops, and that always, is something wonderful to see. In Ontario, we have the Spark Advocacy Grants, and as far as we know, we are the only organization in Canada to fund advocacy efforts, and the grants support communities to advocate for change to ensure that all children have access to physical activity and healthy eating. And we have invested close to $2 million into over 200 communities across Ontario. Now, how are we going to answer this call to action, and what is our will? What are we going to do? Well, we know that it takes an entire team of connectors and networkers on the ground and in communities, and we're lucky as a foundation that we have that across the country, and I know that many of them are here. And so I would like to ask all of my colleagues to stand up so that you can see who they are. They are our hummingbirds. They are doing this work. They are going to share and mobilize the information that we are taking with us from this summit and from all of you, and they are going to make sure that they have those conversations, that they're at those tables in their communities on the ground. So here they are. The Heart and Stroke Foundation cares about and is committed to improving the health of our kids, to get them moving more and sitting less. We play well with others, and we look forward to working with you every step of the way. Thank you.
Hi, everybody. My name is Kelly Simpson. I'm the Manager of Sports Brand Marketing for RBC. We're proud to be an official partner of the Global Summit this year. Thanks to Active Healthy Kids Canada, it's been a fantastic event. Well done. And we were the co-hosts of the session this morning on organized sport and physical activity. Over the course of the summit, we've learned about a number of innovative and compelling solutions from a variety of sectors and from countries around the world to get kids more active. A common theme throughout the conference has been that no one entity, organization, or country can solve this global issue on their own. At RBC, we recognize the value and necessity of partnerships and collaboration to tackle this challenge to get our kids more active. That's why we created the RBC Learn to Play project with a collaborative approach in mind. The project is a multifaceted, fully integrated strategy that includes providing more than $2 million in grants over the next 3 years to support local community organizations across the country. We're working in partnership with Participation and Canadian Sport for Life to ensure we're teaching kids new skills and building their confidence and helping communities to build personalized, transformative action plans for how they deliver sport and recreation programs to kids and youth. Supporting events like RBC Sports Day in Canada, that help families and communities celebrate sport and physical activity and inspire Canadians to get more active. We're helping to fund research and thought leadership initiatives like the Canadian Assessment of Physical Literacy, or CAPL, research project with Dr. Mark Tremblay and the HALO Research Group, and supporting the Active Healthy Kids Canada report card. We're leveraging our partnerships with organizations like the Canadian Olympic Committee, Hockey Canada, and Swimming Canada to provide kids with more opportunities to play and inspire the next generation of athletes. We're also exploring partnership opportunities with government agencies at the national and provincial levels, as well as other funding partners and knowledge experts across multiple sectors. And last but not least, we're educating and mobilizing our 57,000 employees across Canada to take action at home or in their local communities. We know that there's no singular solution that will help mend an activity crisis in Canada. That's why, through our RBC Learn to Play project, we're getting experts, parents, employees, communities, and thousands of kids engaged. Our efforts are about more than money. They have to be in order to create sustainable solutions and make real, lasting change. Thank you.
So I get to wrap it up by telling you from an Active Healthy Kids Canada perspective, we're encouraging all the delegates from around the world to use the report cards that have been presented here by our country partners that was revealed through the Global Matrix at the beginning of the summit. And they're going to be continued to have tools available in the proceedings that are going to come in the months ahead to help you guys inspire dialogue and facilitate solutions in your own communities to improve the grade. And so now I'd just like to call all of our partners forward to just come up on the stage and be recognized.
On behalf of the Board of Directors of Active Healthy Kids Canada, I would like to thank our partner and funders for their participation in this call to action today, for their overall support of the Global Summit on the physical activity of children, and most of all, for their ongoing leadership and support to enhance physical activity opportunities for children and youth. Thank you very much.